Welcome to MeDAP Medical Software Training, Part 2. In this tutorial, we are going to look at the patient registration form. On the main menu, click on the Patient Registration button located over here. A new window will open up, which is the patient registration form. Before we get started, here is a quick MeDAP tip. If you want to jump from one field to another, just hit your Tab key on your keyboard. For instance, if you want to jump from this field to this field, you can hit your Tab key and it will automatically do that for you. The file number, account number, lookup, and extra icons are extra features located within the patient registration form. When you are creating a new patient file, you will start here at Language. These three little stars indicate that these fields are compulsory. The main family member's information must be added in first. The only time when you are not going to use a main family member's information is when it's a WCA claim. Other family members' information are added over here. MeDAP will automatically fill in the initials for you. You can then add a title. Over here you add the ID number, and the ID number is very important. If you do not have an ID number of the patient, you can always just add the birth date of the patient. You can fill in zeros further in the field. This is, however, not recommended. You will cause duplicates inside the MeDAP program database. MeDAP will automatically calculate the age of the patient, located over here. MeDAP will always add the main family member's information at the very top, located over here. Remember to add as many contact details located in these three fields as much as possible in order to contact the patient if you cannot get hold of them on other contact numbers. If you right click on the cell phone number, it gives you a small window where you can send an SMS from within MeDAP. Enter the email address over here. An email address is very important. Referred by can sometimes be very important depending on the practice type. Referred by doctors should be added manually. To do this, empty the field and double click in it, and then this window will appear in front of you, known as the referring practitioners. The main member's home address can be added over here. One feature of the MeDAP program is when you click on this drop down button of the extensions or suburb and start typing, the program will automatically search for that area, and at the same time it will populate the next two fields. When the home address and the postal address is the same, you can click on this button. Then it will add it automatically. Another great feature of MeDAP is if the main member's postal address, let's say for example PO Box 112, you do not have to type in PO Box. Just hit the Tab key on your keyboard and it will add it for you automatically. Over here is where you can choose the medical aid. All the medical aid funds destinations for electronic claims are the same. If you choose any of these options, the destination will still be the same. The only time when it is different is when you choose the CareCross option or DRC. As you can see, CareCross has a different address. Over here is the medical aid number. This is very important, as shown by the golden star. Let's go back to the top of the registration form. Over here is the file number and account number. The account number is a number that MeDAP automatically generates. If the file is ever deleted from the MeDAP program, that number will disappear and never be used again. In other words, it is a unique number. Now let's go back to family members. Now over here, you will add the patient's dependent's information. When you add the first dependent's name, the white line underneath has disappeared. To add another dependent, click on this button over here. And now you can add more in this new field. You can add as many dependents' names, numbers and information as much as you need. Remember to change the dependent or family member's number located over here. You cannot have any duplicates. Remember to add the cell phone number. This is very important. Now let's go down to this part. This is the private notes. Private notes are notes for private use that will not appear on the statements. Note that the blank area is gray. This means it's grayed out. To activate it, just double-click in the empty field. The statement message, you must double-click to activate it as well, and this will display on the account statement. The service type, found over here, should always be left on reference price list, RPL, or private tariffs. The only time when you need to change this is when you have an injury on duty, or if you're going to work with own or private tariffs. Now let's go to the Medical Aid Work Detail tab. This tab is for your medical fund information. This is also for the patient to get his or hers work detail or occupation. For medical aid patients, this is not really necessary. Only when you are dealing with an IOD or injury on duty, this will become necessary. Over here is the Miscellaneous tab. You can add the next of kin contact details. Over here is when you are going to charge interest, you can just tick on that little box. The next tab is also known as the event log. What this tab does, it shows you the activity which you have done recently. And we are done with the patient registration form. You only have to do this once and it will stay in the database.